calls that come in through the 111 service, if there's anything nursing related, such as a catheter problem or a dressing that needs to be done, then that would be referred directly onto us, and we'll pass that through to a community nurse in that area. If a patient or carer rings directly through to us here, we can then speak to them on the phone about whatever problem they've got and see if a district nurse is needed to go out there and then, and we can organise that. In my current role, we didn't have a lot of involvement with the 999 service. Of course, there is some overlap, and you know, we have noticed things are quicker and slicker. So if a person needs an ambulance, they're more likely to get one in a quicker time. And for somebody who doesn't necessarily need an ambulance but they need help, they can be referred through to the 111 side. Some people will ring in 999 for, you know, the things that really aren't an emergency, which can be dealt with by the 111 service, and vice versa. Other people may ring in with a problem which is then deemed to be more of an emergency than what they first thought. So there's a better crossover, and of course as district nurses we can deal with a fair amount of the calls that come in as well, if it's something to do with a dressing or a catheter or somebody who's poorly. Well, for the patients, it's an easy number to remember for a start. You know, before it was quite a long sort of mobile type number which they could never remember. The 111 is really easy and quick. Patients are more likely to ring it, and we also feel confident that when we leave them, we know that they've got another contact that they can call if there's a problem overnight or at the weekends, which is often the time when there can be a crisis or a problem that previously they might not have dealt with very well. So from that point of view, it's a lot better. Sometimes we get calls from patients that we know, you know, because I work in a particular area and we know some of the patients that ring in often, and we're more able to reassure them and get their problems dealt with quickly rather than it progressing on for any long length of time and they're sort of sat at home getting distressed about it. So that's better. We obviously leave messages for each other. We all write in the same book so you can see what's been happening the day before and the shift before, because often it's the same people that may be ringing.